Hello everyone, welcome to CAPSA. Today we will learn about control release drug delivery system. Control release drug delivery system, or also known as CRDDS. Okay. Now, what is control release drug delivery system? This is the system which releases the drug in a controlled manner over time, aiming to release the drug for a longer period of time, or the system which releases drug in a controlled manner over time, or for a longer period of time. Okay. This control release drug delivery system actually acts through the release of drug by diffusion, osmosis, chemical degradation, swelling and dissolution, etc. So the drug through osmosis, diffusion, chemical degradation, swelling or dissolution, etc. Now, what are the examples? Examples are transdermal patches, implantable pumps, intramuscular depot injections, etc. Okay. Now we will understand this through a graph. This is x-axis, this is y-axis. In the x-axis, we will write time. In the y-axis, we will write cumulative drug release. Okay. Now, when we will apply a dose like dose 1, we can see a graph like this. It means when we are applying dose 1, it goes through a controlled manner for longer period of time, maintaining a steady state plasma concentration level. Now, this is the minimum effective concentration, and this is the minimum toxic concentration. Okay. In between this, that is known as therapeutic index. Okay. Now we will understand what are the types. So, control release drug delivery system are of 4 types. types. Okay. First one is pre-programmed rate type of drug delivery system or control release drug delivery system. Okay. In this system, release rate is controlled by the diffusion rate. Okay. Now we will understand this through a diagram. These are the drugs. This is the rate controlling surface. This is the drug reservoir. And these are the drug release. Okay. So the rate of release controlled by the diffusion rate and occurs the release of drug. Okay. Now the second one is activation modulated type of control release drug delivery system. In this type of control release drug delivery system, the release rate is controlled by osmotic pressure, hydrodynamic pressure, mechanical pressure, redox agents or redox reactions, enzymatic reactions, etc. Now we will understand it through a diagram like previous diagram. This is the rate controlling surface. Drug reservoir. This is the energy sensor. So, release rate is controlled by osmotic pressure, hydrodynamic pressure, mechanical pressure, redox reaction, enzymatic reactions. When these type of reactions occur, energy sensor get activated and causes the release of drug through the rate controlling surface. Okay. Now, coming to the next, third one, that is feedback regulated control release drug delivery system. Okay. In this type of system, the release of drug is triggered by various agents which are present in the body fluids. Okay, now we will understand it through a diagram. This is the rate controlling surface. Energy sensor or biochemical responsiveness, and drug reservoir. In the body fluids, when this kind of drug delivery system reaches, the various agents causes the stimulation of energy sensor, which gets causes activation of the energy sensor and release of drug through this system. Okay, these are the body fluids and causes release of drug. Okay, now coming to the next, the fourth one is site targeting control release drug delivery system. In this type of system, the release of drug or the release rate is controlled to target the tissue, not the transport path. Now we will understand it through a diagram. Rate controlling surface, drug reservoir, energy sensor or biochemical responsiveness, and this is the targeting site. Okay, so the release rate of drug is controlled to target the tissue, not the transport path or the rate controlling surface. Okay, Now, what are the advantages and disadvantages of controlled drug delivery system? So, first advantage is maintenance of optimum drug concentration. Second one is augmentation of duration of therapeutic effect. Third one is improves treatment efficiency with lesser amount of drug. And the fourth one is reduce side effects. Fifth one is lesser frequent administration. Sixth one is increased patient compliance. Maintenance of steady state plasma concentration of or plasma concentration level of drug. So these are the advantages. Now, what are the disadvantages? Disadvantages. Coming to the first, dose dumping due to intake of food. Lack of biocompatibility. Poor aqueous solubility. Poor aqueous solubility. And the fourth one is poor drug selectivity. Fifth one is increased risk of toxicity. Sixth one is higher cost of formulation. So these are the disadvantages. Thank you for your attention.